that the transport back and forth would be successful. And so she was unable to get that CT scan, which we were charged $60,000 for. So that was really upsetting. What was also interesting and equally confusing about the whole CT scan debacle is that, you know, the doctor finally came to do rounds and he said, well, did you go get the CT scan? And she said no. And he asked the charge nurse, well, why wasn't this patient sent to go get her CT scan? And the charge nurse said, I wasn't aware of an order being written for her to get a CT scan. So that's alarming to us as the family members, because typically when somebody is admitted to a hospital, you have a chart. All of your medical records should be documented in that chart. You know, there seemed to be so much confusion with her plan and treatment of care. We don't believe that there was a comprehensive care plan outlined from the inception of her admission to the length of stay, and unfortunately to the time that she passed away. There was just a lot of inconsistencies with the care, a lot of inconsistencies and disregard to her diet. I mean, my aunt is diabetic, so that should have been a part of the initial assessment. That should have been in her medical records. You should be able to distinguish in a medical facility when you're feeding patients who requires regular food, who requires diabetic food, who requires mechanical soft, pureed, liquid diets, so on and so forth. With my aunt being diabetic, they were giving her regular food that contained sugar. There were instances where she wouldn't eat because they were telling her that she would be prepped to go get the CT scan. So she hasn't eaten anything. She's, you know, not drank anything. So her insulin levels are just going all over the place. And, you know, later on in the day, they would come and apply, you know, some insulin just to kind of level it out. So the care was just all over the place. It wasn't concentrated. It was not strategic. It was not appropriately outlined. And it was not, there wasn't any dedication or compassion to treating my aunt and making sure that she was comfortable. One day she was speaking to my mom, and we can hear on the voice note one of the male nurses saying, "Who are you talking to?" Why is a nurse concerned about who my aunt is talking to? Why is a nurse concerned about who a patient is talking to? Unless you are concerned about the poor level of care that you're rendering and you're concerned that perhaps the patient is, you know, placing a complaint against you. So there were just a lot of inconsistencies and a lot of discrepancies with the care, and just the condition in the treatment. There were times, and I'm so sorry to have to say this, my aunt had to bribe the nurses to warm up her food and to escort her to the bathroom. That shouldn't be in a medical institution. That's ludicrous. So surely you can understand our frustration, you know, in having to speak to her every day, having her being alert and oriented, cognitively aware of her surroundings, giving us blow by blow accounts of everything that was going on. We're not allowed into the hospital, so we're feeling helpless as her family members. And she's basically helpless in there because nobody's rendering appropriate medical care. I'm not sure if my cousin is on this call, but I'll pause, and I don't know if you have any questions for me, but it's just really frustrating. And, you know, as Mr. Ford said earlier in the call, he said that my aunt's death was unavoidable, and I agree 110% with him. I think that if the facility was appropriately staffed, if the staff was well trained, and if the facility had the appropriate equipment to render the medical care that these patients required, then my aunt would still be here today. And so I think it's important for us to have this dialogue and for us to bring awareness to the ghastly treatment that my aunt received. And, you know, in doing so, our hope is that other family members won't have to go through what we went through, because this was completely unnecessary. This could have been avoided.
Thank you very much for that, sad and still outstanding chronological account of the circumstances that led to the sad passing of Nurse Maynard Kizzy Emery. Thank you very much. As you indicated, there are a number of family members who are on in this press conference, and we would like to allow each of them the opportunity, if they would like, to share with us their thoughts, maybe briefly in a minute or two. Would any family member like to share their thoughts with us before we get to the questions from the media?
Hi.
If you
my name is Melissa. Hi, can you guys hear me?
Yes, we can. If you can state your name, which you have, and how you related to Nurse Maynard. Thank you.
I'm her niece. My name is Melissa. Basically, my cousin covered everything, almost everything. I just want to point out one thing. Today, my cousins went to get the refund from the refund for the the CT scan from Mercy, and the staff told my cousins that they kept calling for Vanessa Maynard. They kept calling Lillian Dow Hospital from Vanessa Maynard, and they were asking, okay, where's this patient? She's scheduled for a CT scan, almost every day. And they kept telling her that, oh, she's in the ICU, even when she was not in the ICU. So every time they call, they kept telling her, oh, she's in the ICU, she's in the ICU. And they said, they called for other patients there, and they told them the same thing. Oh, they're in the ICU. So that is very, very concerning. That's all I would like to say, because my cousin covered everything already.
Thank you very much, Melissa. Is there any other family member who would like to share their thoughts? Okay, perhaps not at this time, but we will allow you the opportunity to do so later in the press conference if you'd like. We'll now like to take questions from the media. I see that Svetlana Marshall of Village Voice has her hand up. We'll take your questions. Svetlana, go right ahead.
Hi, good afternoon. I think the second person that spoke, Melissa, cleared up a bit about the CT scan. I want a clarification about when it was eventually done. I just learned it wasn't. But could you say which date exactly the request was made for her to do the CT scan? I want to measure the length of time up to the time of death.
Okay, it was last Friday. Last Friday, the doctor ordered the CT scan because her heart rate kept fluctuating, and he was concerned that it might be a blood clot. So he ordered the CT scan last Friday. I don't know what day. I have to check. If you can check the date, I don't know what date that was.
Svetlana, are you clearer now?
Yes, thank you so much. Secondly, could you say if she was vaccinated or not?
Is that necessary?
I don't see the relevance in whether she was vaccinated or not.
Yeah,
the point is she's no longer here. I'm sorry, but she's no longer here. I think the question at hand is, us trying to address the incompetence of that facility.
Okay, we understand. Svetlana, do you have another question, or can we go to Thandika Percival of Stabroek News?
That's all for now. Thank you.
Thank you. Thandika, go right ahead.
Hi, good day. Percival, Stabroek News. Just a little bit of a housekeeping. Could you give us an idea as to how old Nurse Maynard was, and give us an idea as to the date she was actually admitted to hospital?
Certainly. I think Kizzy would have provided the date before, but Kizzy, if you can kindly remind us of that, please.
She was 56 years old. Melissa, do you remember the date of admission? My mom is listening, so we'll get you the date of admission, Thandika. But
okay,
my aunt was 56 years old.
Thank you. Adam Harris.
Hi, I'm listening. The date of admission was the Sunday before. Sunday gone was 1 week, so I don't have a calendar in front of me, but Sunday was a week. So it was the Sunday prior.
That appears as though it would be the August 29th.
29, yes.
Yes. Mhm.
Thank you very much for that information. Adam, go ahead with your question. Adam, we're not hearing you.
You know?
Yes, we can. Go ahead.
Okay. Kizzy, are you in a position to say how many people would have been in the hospital with your aunt at the time? I'm trying to find out about the number of nurses per patient, or number of nurse per patient at the time, because obviously you're suggesting negligence. And at the same time, I'm trying to wrap my head around the situation of the hospital locking out nurses when these very nurses are so desperately needed.
Melissa, do you recall? I believe they said they had 70-something patients to 6 nurses and 3 doctors.
I
Yeah,
think she
4 or
said
5
64 patients with 4 nurses. That's what she said.
And just to clarify, you're saying 64?
64 patients with 4 nurses.
4 nurses. Thank you.
And may I ask another question? At any time with all of this thing going on, did anyone try to get to the administrator or the minister or somebody of the Georgetown Public Hospital to report exactly what was happening to the people there? And I'll tell you why after this.
Her daughter was getting phone calls every day. She was getting updated from the hospital, but they called from an unknown number, and she didn't have access to calling them back or calling anybody. And she was told that she couldn't go there to see her mom or take anything. So she didn't report it or go anywhere because she was depending on them to give her information.
Adam, do you have a follow-up?
Yeah. And my follow-up is, if there was nobody, well, you said the daughter could not reach any official at the hospital. I'm sorry that somebody didn't reach out to either of us anyhow, because many of us would have had access. And as the opposition leader said, this could have been avoided. Now, my next question is, do you propose to pursue this matter legally or otherwise, bearing in mind that you seem to have evidence of incompetence, mistreatment, and the like?
We will not answer that question right now. We just need to discuss that further amongst the family.
Thank you very much. Svetlana? Adam, you have another question?
No, sir.
Okay. I see Svetlana Marshall would like to ask another question. Svetlana, go right ahead.
Just one question. I just want to know how long she would have served in the medical field as a nurse, the years of service.
Since she was 18 years old, she joined Davis Memorial after graduating her school, Border. She went to Border Community, and right after that, she joined Davis Memorial.
So that's 38 years.
Thank you very much. I see someone from News Talk Radio. Is that Dennis or Sean?
Dennis. Good day, everyone. Dennis Chabot, News Talk Radio. Ma'am, I'm hoping you can tell me whether you think Nurse Maynard would have stood a better chance if indeed she had been vaccinated, and to what extent do you believe that the underlying conditions may have contributed to her demise, whether indeed you may be aware that she was managing her own conditions, comorbidities adequately prior to her hospitalization.
So recent studies and events have shown that people who are fully vaccinated have caught the COVID virus again. So respectfully, I don't necessarily see the merit in that question, because I think whether you're vaccinated or not vaccinated, you're still liable to get COVID. And with regards to her underlying condition, that's another cause for concern, because yes, she was diabetic, and while we're putting the spotlight on Liliendahl Hospital, I'd just like to share quite briefly that my aunt had a medical injury which required her to go to a separate facility prior to Liliendahl, which required her getting some dressing done in her feet. We're told that days later, when she went back for a cleanup, that hospital notified her that the nurses who had done the initial dressing on her feet both tested positive for COVID. They knew that information for several days and did not contact her. So as far as contact tracing goes over there, I'm not entirely sure what stringent policies you have in place, but one would wish and hope and think that from the moment a person, especially a medical professional, has been identified or has confirmed to have COVID virus, all persons that they've come into contact with should be contacted within 24 hours, right? And so if two nurses rendered services to my aunt at a different facility and they both tested positive for COVID, that medical facility had my aunt's contact information. They were required to notify her and they failed to do so. So it's really frustrating, because it's several of these medical facilities in Guyana where you see folks are dropping the ball as far as notifying people when they've contracted COVID, and also rendering appropriate care in a timely manner to minimize the progression of this virus.
I'm following your argument about people being vaccinated having caught the virus, but as you may well be aware, that one of the arguments is, and even until yesterday, the President of the United States stated it, that if you're vaccinated, you stand a better chance of surviving. So that's why I'm asking you whether indeed Nurse Maynard was indeed vaccinated. And it remains a relevant question, not only locally, but globally.
Dennis, I agree with you that the question is relevant, but it was the second time that it was asked. I'm not sure if you were aware that it was asked previously, and it is clear that the family is not prepared to go there at this time. Perhaps they may do so at a later time, but in their current state, it is understandable if they would not wish to go into those details at this time. And I believe we should respect them in their time of mourning. So if you have another question, we'll take it. Are there any other questions from the media? Kizzy, is there any member, yourself or any member of the family, who would like to add anything at this time that you may not have mentioned before? Adam, do you have a question?
Yes, sir.
Go right ahead.
My question, sir, is the family, you took her to the Georgetown Public Hospital on the 29th of August, and she went to Liliendahl when? I can't remember.
Later
But
that
I need
night,
the same 29th?
she was transferred, they said 10 p.m. that night to Liliendahl.
No, she went there during the day and she was transferred 2 a.m. in the morning.
Okay, even later, wow.
So that would mean that she was transferred to Liliendahl at 2 a.m. on August 30th.
Hello,
Right.
may I interject, please?
Oh, great.
Tandika?
Hello?
Yes, go ahead.
Yes, I'm her daughter.
Oh,
Kanisha?
Kanisha, welcome. Our condolences.
Yes, thank you. I took her to the hospital on the 29th, and we got there 1 something at Georgetown Public Hospital. They were running some tests They wanted to see if they could have treated her as an outpatient instead of inpatient, because she was afraid to go to the Lillian Dow Hospital because of the stats. However, the doctor who took her tests and so on, apparently his shift was over and he left. So the nurse a nurse came and just told us that they were transferring her. So she ended up going over with the ambulance 10-something to Lillian Dow Hospital the same 29th of August.
It's 10-something in the night?
Yes, correct. 10-something in the night.
That brings me to the point. She went to GPHC. Obviously, they would have suspected or tested for COVID. What did they do at the Georgetown Public Hospital while she was there from 1:30 or whenever you took her until 10 the night?
Okay. When we got there, they took her to get an x-ray done. After she had the x-ray, the machine wasn't working, so they asked us to take a photo with our phone to show the doctor when we got back to the outpost, the COVID outpost.
Sorry. Photo of what? Take with your phone.
The x-ray, from the x-ray machine, whatever that they call, we have to take a photo with our phone because it wasn't working for them to send it to the doctor.
Unacceptable.
Yes. So when we got back to the outpost, they had her in a wheelchair on oxygen. Another doctor came and they pulled blood from her to do various tests. And then another doctor came and checked her foot because she had an abscess, a diabetic ulcer. And they said that it was clean, it was healing nicely, and so on. But they said that it was due for to be changed, the dressing, but they hadn't any bandages or so out there at that time. So they said they would have done it later, which is another problem because when she was transferred, they did not look at it either the next day either. She called us, she told us she had to cry, and she told them, I'm a nurse, just bring the gauze, bring the iodine, I'll do it myself, because she opened the bandages, she saw that it was green. It had become infected. She called us telling us that also. So she was under there just waiting for the test results. The doctor came about 5-something and told her they're waiting for 2 more results. And he left and we never saw him back. We were sitting there till 10-something when the other nurse came to have her transferred to the Lillian Dow Hospital.
Thank you.
Thank you, Janisha.
If I may,
Yes, Dandy, go
Tanisha
ahead.
or any other member of the family, you mentioned that when Ms. Maynard went to have her leg dressed, she was told that she was exposed. Could you give us a date or a timeline between then and when she began displaying symptoms?
Thank you.
Okay, so the Sunday she went in hospital, so that she was transferred as the 29th. The Wednesday before, that is when we went to Davis Memorial Hospital to do the dressing. But remember, she was a nurse there. So one of her colleagues, so that would have been the 25th, one of her colleagues gave her a wink and just told her that because they were fumigating and they told us we had to wait before she did her dressing. So we went back to the car, we were waiting, and we went in back. And one of her colleagues said that, okay, these nurses that were doing your dressing, they actually tested positive for COVID. So we got concerned and we decided to do for a test. We started quarantining first.
But what did she have the dressing? You said the 26th she was told, okay, these persons who had done the dressing before have tested positive. But when was the dressing itself?
25th. It was the same day she went. It was the 25th. We were waiting on the dressing to get the dressing done when we were told that she can't go inside because they were fumigating, so she needed to wait outside. That's when, even at that time when she was waiting, she said that she started to see dark. She even told me that, I'm not seeing your face, and the nurse ran quickly and did her blood sugar, and we did some juice and stuff for her. A bit after, when they finished fumigating, she was able to go inside and get her dressing done. That was the same 25th. Later that day, when she was told by a friend, a colleague, a former colleague, that the nurses that were doing her dressing, days before, they were tested positive for COVID.
Thank you, Kanisha. Tanika, is that clear?
Sure, thank you.
Wednesday, August 25th, 25.
The question, sir. Has
Whereas
has anybody from the Georgetown Public Hospital, the Ministry of Health, or what, reached out to the family? Normally, they would inform you of the death. How were you informed of your aunt's death?
Okay.
You should have a call. Go ahead.
Yesterday morning, the doctor called me, and the doctor asked me, who am I to Nancy? I said, I'm her daughter. And then they said, what do I know about the situation? Am I aware that she's in ICU? I said, yes. I was aware that she went down to the ICU yesterday. She actually called and told me, because the day before, no one contacted me. He apologized for that, and he explained that she got worse over, and the oxygen wasn't enough, so they had to bring her down. I asked how much liters, because I know she was on 10 liters, and she was doing fine. They said they put it up to 20 liters, and it wasn't enough, so they had to take her downstairs and so on. So I informed him of everything I was told, and so on, and then he said, okay, well, Nancy passed. And, well, I was hysterical after that.
But can I just point something out? And Kanisha, if you can, just to be very specific and just put a spotlight on this, can you tell them again the time it took the doctor to notify you that she had been transported to ICU? Like the length of time that took, because you were not notified right away. You were notified hours later, right?
Correct. Exactly, correct. My mother called me, I think it was 6, I don't know the exact time, but I know it was after 6, because I left the house 6 o'clock. And she told me that she got worse overnight and they had to bring her down to the ICU. And I told her, okay, stop talking. You don't talk anymore and so on. You rest and breathe and so on. 2 hours after, I was contacted by the hospital and they told me. And the first thing I told them, I was angry. So I asked them, why wasn't I updated the day before? Because I received no call the entire day before. Everything I knew was what my mother sent to me. Through message, through voice note, stuff we could call, that was it. Nothing from them. And days before also, they did not contact me. And I told mom to tell the doctor, why aren't they contacting me? Because I would ask what medication she's on, because they don't tell her. When she asks them what they're giving her, they get annoyed because she's going to ask, what injection is this? What tablet is this? What is this? So they stop answering her. And when you're giving a patient something, you should tell them what they're receiving before giving it to them.
Exactly.
So it's like the patient has no rights in this facility, right? I mean, as medical professionals on this panel, we're aware of the patient bill of rights, but in this situation, it seems like the patient was disregarded at every step of the way, right? As a medical professional, you have to exude compassion. Before anything else, you have to exude compassion in order to care for your patient, right? Competently. You have to be skilled. You have to be educated, right? And if you're exhausted because your facility is understaffed, even as a grieving family member, how much can we truly blame the staff if they're understaffed? Because ultimately, the staff is not the decision makers, right? It's the ministers and the people above, the administrators and those folks. They determine how many employees are staffed at a medical facility. So I think we have to put a spotlight on the healthcare infrastructure in that country, right?
Exactly.
We have to address, I'm sorry, respectfully, of course, but we have to address
I'm
that.
listening. Oh, you listening?
Hi, ladies, could one of you assist me? You mentioned that your mother would have reached out to you to mention the medication that she would receive it. You noted that she was on 10 liters of oxygen, which was raised to 20. Could you note any other medication that she would have been treated with during her time at the hospital?
Yes. So whenever the doctor updated me, the first thing I would ask, the first day they called, I would ask exactly what she was given and so on. And I was told that she was on dexamethasone the first day, and she was given well, she was using insulin, so they took her off of the, can't remember what the blood sugar medication is called, but they took her off of that, and that is what she was on the first day alone. And then the second day, they told me that they did not make any changes. They only gave her the blood thinners. I think it's heparin. Yes. And the third day, the doctor called, and the doctor told me that we just started dexamethasone. So I said, you just started? On Monday, I was told that she was on dexamethasone, and she actually was on dexamethasone before she went in there. After we know that she was exposed and so on, just as a precaution and so on. So what happened Tuesday was she not on it, and then the doctor, I could not even understand what she was saying because she spoke Spanish, so it was hard. There was a language barrier to understand her English, and there was an excuse that I couldn't understand. I still am not clear to this day why she wasn't given dexamethasone Tuesday, but it had to be that she wasn't given it. If Wednesday they told me that they started her on it, either or maybe they stopped it or she wasn't placed on it Monday. I don't know. I would really like to see her her medical records.
Would we be able to obtain a copy of that?
Pardon me?
No, I'm asking the panel, Dr. Karen Cummings. I don't know if you are privy to this information, but as the family, can we request a copy of my aunt's medical records?
Dr. Cummings, would you be able to clarify?
Yeah, I will. I don't know if the protocol has changed since this government has taken over. But you should be able to get some information, especially if you're taking legal action. That you're able to do for the records. So I don't know what's happening with this present government.
Do you think
I can find out?
Do you think we would have to escalate this request to the Minister of Health to obtain a copy of her medical records?
Why not? Sure. I mean, it's your right. You can ask. You know, I'm listening. So many things are running through my Imran. You know, and their service. I mean, in Guyana, we do have a duty to care and to provide emergency, timely, appropriate treatment to all Guyanese. More so, a nurse would have given almost all her life to the health profession. So I wouldn't be surprised if the hospital staff, the administrator, whoever, would have acted in such a manner, and that the medical team, the team is unable to fulfill their duty of care to the patient. They would have, that means that the laws would have been broken under the regulations, the different acts, the Allied Health Workers Act, the Medical Practitioners Act, And so this matter should be investigated by the Ministry of Public Health and even by the police, DPP, and if you want to take, it seems to be some kind of negligent, somewhere, and it can, to some extent, be as bad as a worse scenario, manslaughter. I'm serious because I know her. She gave all her time to the health profession, and so I don't know if you want to, later file civil action and so forth. But I mean, you will be in your right because I have listened carefully. I mean, throughout the, if I can come in here once again, throughout our time in office, I'm being the shadow of health, and Honorable Riser can bear me out in that. We kept saying the right now COVID-19 has provided an opportunity for us to work together. As APNU, we're responsible to over 218,000 persons in Guyana, and you can't do things unilaterally. We have to work together. There's uptick in cases. Right now, it's over 27,000 plus patients, confirmed cases. We have 659 deaths, which to some side, in my mind, it's untimely as well. Some of those can be prevented. 2,504 in home isolation. What does that mean? If we've gotten there that there hasn't been contact tracing. There's a problem with contact tracing. And over 24 hours, you're having 240 new cases. 36 patients in ICU. The nurse to patient ratio. I mean, so many things are raising red flags. And then quality issues have been alleged also, that they're running out of oxygen, not enough ventilators and monitors. Of course, this has been substantiated by Dr. Carpin himself, where he's saying that we're trying to get more ventilators, we're trying to get more monitors. It's racing against the clock, and we have to be in more proactive mode than a reactive mode. Also, it has been brought to my attention poor supervision of clinicians. You have some junior doctors where I think you may need, in cases like those, you need more seasoned, physicians to work in those patients, Also, persons are saying not enough food and toilet paper and all these things. You don't know the meals, and the list goes on. I mean, we're not here to complain. We're all Guyanese and we want to make a change. And that's why you brought it to us so that we can address these issues rather than running and hiding escapism. We want to confront the issues and see that it doesn't happen again.
Thank you, Dr. Cummings. Kizzy, Kenesha, Ms. Moore, and other members of the family, certainly what we can commit to do is to have our broader medical team in-house and our attorneys examine that particular question that you've asked and provide some guidance. And that can be done sometime, I believe, within the next couple of days. I see that Dennis would like to ask another question.
Yes, I just wanted to know from Nurse Maynard's daughter whether when she was in dexamethasone, whether she had also been in any sort of a medication to reduce the blood sugar at the same time.
Kenesha, would you be able to?
I'm trying to remember what is the name of the blood sugar medication. I can't remember. She was.
I think you said, Kenesha, it was something about glyphosine or something.
Glycoside.
Paired with
metformin.
Metformin. That's
micron-MR. Yes, glycoside is a common drugs that are used for those in diabetes.
So, Kenesha, can we just get those clearly? Metformin and what else did you say?
You say metformin and glycoside?
Yes, Dr. Cummings.
Thank you. Mark Benchcott? Adam, we'll come back to you. I'd just like to get Mark in.
Hi, I have two questions. In fact, one is for the Shadow Health, Dr. Cummings, and the other one for Kizzy, the family member, or any other family. The first one for Dr. Cummings is. Yep, sorry. Yeah, so I'll go directly to the family member. If the Minister of Health is watching this press conference at the moment, what specific message you have for the Minister of Health and by extension the PPP regime in what is perceived as the gross mishandling of the COVID-19 pandemic throughout Guyana? What will be your message to the Minister of Health and his regime?
Kenesha, do you want to go first?
No, you go ahead.
Okay. They have to reassess, reevaluate, and reconstruct the entire healthcare infrastructure in Guyana. Okay? The healthcare of the people of that country should not be based on politics, right? There are two different models altogether. And the livelihood and the well-being of the citizens of that country should not be based on, who I voted for or who I didn't vote for. The bottom line should be that the government, more so the minister, should be focused on making sure that the healthcare facilities are well-staffed, well-equipped, and well-modeled to facilitate and accommodate and care for their patients, okay? As a family member, I can't stress how hurtful and how frustrating and how angry it makes me feel knowing that we were communicating with our aunt every single day. Kenesha was communicating with her mom every single day. So to bring to terms and bring to sense the relevance of her death, it's unfathomable. We can't put it into words. We can't make it make sense because it was so unavoidable and it was so unnecessary. And then when you look at the basic elements, they were understaffed. They were ill-equipped. Best practices were not being allocated in that facility. So I think that's what people need to look at. I'm really not big on the politics. For me, it's more so about the medical care that is being, doled out to the patients. And people want to make sure that their family members go into a hospital for a specific medical condition and they're able to come out safely, and treated appropriately for that condition. It shouldn't be anything, as appalling as this is what happened to my aunt.
Yeah, thanks. And my other question is for Dr. Cummings. During this entire pandemic period, and more so after the change of government to this, my interpretation, and I bet a lot of people agree, installed regime, have you ever, Dr. Cummings, been contacted by the Minister of Health to have a political, bipartisan approach in dealing with this COVID-19 pandemic that has gotten completely out of control under the PPP?
Absolutely, Mark. I hear your questions. It's not a matter of trying. We have been trying. I personally would have WhatsApp now to the Prime Minister who heads the task force. I've spoken to the minister myself because I've known him long before he turned minister. And so what we have in Guyana is mature politics, So if you are a career in health, and so you came from the last government, all right, you have to work assiduously to make sure that you maintain your space. Because at anything they're trying to move, in other words, when a new government comes, you move out. You can't have a career path in health. And so we have to, that's the impression that people are seeing it through their lens and perspective. And so they have to have this inclusion, it's kind of, I don't want to use the word systemic racism. What we need is inclusionary. You can't just talk about a one Guyana, it's just rhetoric. You must be able to show it in action. And so, not for want of trying, we have been reaching out. The opposition leader would have been saying, he said it in Parliament, but to no avail. And this is an optimal time for us to work. COVID presents an opportunity for us to work together as a team.
Thank you, Dr. Cummings. Adam, would you like to come in with your question?
Sir, yes, sir. And this is a question to Dr. Cummings. The figures we given: 64 patients, 4 nurses. Obviously, Lillian appears to be a concentration camp. Dr. Cummings, what would have been the ideal composition of staff to patients at Lilienthal, given the fact that these are people who are seriously ill?
What's his name again? Adam.
Yeah.
That's a critical care unit. And basically, for one, you need about one to three, the most.
1 to 3.
1 to 3, because it's a critical care. 1 to 3. You shouldn't have more than that. 1 to 3. Intensive care, so you can't have so many patients to one nurse. Ideally, 1 to 1 or 1 to 3 for critical care patients. Critical care.
Thank you.
Thank you, Dr. Cummings. So, Adam, they're short about 18 nurses. The quota ought to be about 21 at minimum. Dennis, I see your hand is up. Would you like to come back?
Yes, I want to ask Dr. Cummings. Whether what's your assessment about this whole question of being part of the COVID task force? Whether you believe it is a cyclical problem facing Guyana, because while your party and coalition had been in government, the PP had been calling to be part of the task force, and they were not allowed in. Now they're in government, and you're calling to be part of the task force, and you're not allowing you in.
Adam, Dennis, just as I was secretary of the National Task Force under the APNUFT administration, I just have to clarify and correct that an invitation was extended in writing by the then Chairman Prime Minister Moses Nagamutu to the opposition, but that invitation was not taken up at the time.
Fair enough.
But your question is not invalid, but I just like to clarify the facts.
You're absolutely right, Imran. And the truth is that did, they went and formed another task force by themselves.
Parallel.
A parallel, that's correct. A parallel task force on top of that.
Right, but so my question still remains, Doctor, how do we break out of this, what appears to be a cyclical political crisis facing a national problem, where one party feels that it should not be part of for whatever reason, and or bluntly will refuse to accept an invitation to be part of the process?
Dennis, we're all Guyanese. Our goal is the same lives. We want our healthcare system to be the best in Guyana, in the Caribbean. I don't want to extend it to the world. We want to give persons, the best that we can have, best practices and so forth, that was mentioned earlier. And so, as was mentioned also, COVID doesn't have race, it doesn't have religion. So this is an opportunity for us to come together. If tomorrow morning, Mr. Anthony sends me a letter, sends me whatever through opposition leader, whatever, the secretary there, saying he wants us to the task force, we will be the first to go there. Because this is health of the nation. We talk about the wealth of the nation, but it's really the health of the nation.
Do you see the lead, Dr. Cummings, for perhaps, I know you said you've been in contact with the health minister and the prime minister, but do you see, given the seriousness of the problem faced in the country, the need to formally write the government requesting to be part of this process, rather than just making the calls publicly through the media?
Dennis, again, on a point of correcting the facts, the opposition leader did write to the president, Irfaan Ali, requesting that and a number of other issues. I can share with you, again, that letter was shared with the media, but
that has been some time ago, Imran.
It was about 2 months ago, if I recall correctly, but I can recirculate it. If you're asking if there should be another round of letter writing, then that would be a different question.
But
Yes.
Imran, it's not a letter writing, it's a response. Did we get a response from them? We had written, but did we get a response?
No response, no acknowledgement as far as I'm aware. Not even an acknowledgement to the letter. We'll take a final question from Mark Benchcott. Mark, you'll have the final question, and then we'll ask for closing remarks from the panelists and the members of the family.
Thank you, Imran. This is directed to Dr. Cummings, Karen Cummings, concerning complaints received that COVID-19 patients at the Liliendahl Hospital are actually not being treated for or not given any sort of medication for COVID-19. And I know you have covered, or others have covered, the treatment of those patients at the hospital, which is highly questionable. The other question concerns private institutions, medical institutions that are overcharging individuals. In fact, they're charging them hundreds of thousands of dollars, pretending that they're treating patients with COVID-19. And when they reach to a point that they have exhausted the amount of monies people would have been able to pay family members, that is when those patients are transferred to the COVID-19 hospital. Are you concerned that those private medical institutions are fleecing family members of their hard-earned money, knowing very well that they cannot cure the patient?
Thank you, Mark. Dr. Cummings, in responding to the question, can you also take a minute to provide us with your wrap-up remarks as well? Thank you.
Thank you very much, Imran. Thanks for the question, Mark. Mark, as I said before, health is not only an absence of disease, but a total well-being. That's WHO's definition of health. A holistic approach. And so whilst we are, just to digress a little bit, our APNU AFC, we're not against the vaccines. I have been vaccinated. I have worked with the nurse Cummings from United States of America, who would have given Kamala Harris, the vice president, her inoculation or vaccination. She was brought here. Both of us, we went to Linden because it was thought that Linden was low in coverage. And what's one of our strongholds, we said let's begin at home. And so we went there, speak to patients and speak to nurses and so forth. So whip up the vaccination drive. But as I said before, vaccination alone is not the answer. It has to be a holistic approach. It has to do with diet. And coming back to the COVID hospital, it has been alleged that they're not having a diet there. Maybe barely 2 meals a day, if any, 1 meal and so forth. So I don't know if there's the food policy division from the Ministry of Health is having a hand in, or who is in charge of the meal preparation here. So here, what's her name? The late Maynard Vanessa was a diabetic. So I don't know, her meals, what it was, So that's one. So to answer your question, we are willing to work with them. I think that health in Guyana is decentralized. I'm coming back to the private, of course, they're private hospitals. And some of our very good friends, maybe at the government, they have hands in some of these labs and some other things. I won't go down that road. But the point is, health, the public system is decentralized. We have 10 administrative or developmental regions. We have 5 tiers of healthcare. Starting from the top, we have our only referral hospital, that's the Georgetown Public Hospital Corporation. We have our regional hospitals. We have our district, or we call it cottage hospitals. We have health centers, primary care physicians. We have family physicians there. So that's what I'm saying. We're looking at best practices. Now, the way things are going now, people are now going to monoclonal antibody treatment, whereby you can go, that's an outpatient, you can go in there for a few days and in these regional hospitals and start walking in less than 10 days. In a week, you can come out there. So the whole entire approach, you must have a comprehensive plan. A patient is diabetic. I have to review. I have not been able to see the protocols and the treatment guidelines. And so everything is under, you're not free. Data is a problem here in Guyana. We have a problem with data. We are information rich, but data poor. And so we have to work together to debunk these myths and this secrecy and mistrust. No wonder we're having problem with the vaccination, because the public doesn't trust the government, So the Minister of Government, he is overall health minister, not only for the public facilities that we have or at the different tiers of healthcare, but also for the private. And so I don't know, he's not saying anything about those kind of prices that are being filtered down to the public, to the ordinary citizens. Because if you're going to ask a person every 3 days to do a PCR test, which costs so much, for so many days, every 3 days, for so many days a week, multiplied by a month, it's almost some of the nurse's salary you're talking about there, And so it's really a sad situation over here. So in my wrap up, I wish that the Ministry of Public Health will not only send persons home in isolation, but will follow up with the three T's of the testing and treatment and contact tracing. I encourage the patients out there, nurses and otherwise, to practice the 3 W's, the public and social measures. Wear your mask correctly, cover your nose and your mouth, wash your hands with soap and water, and watch your distance. And I'm hoping that the government will work together with the opposition, who is responsible for 218,000 persons that voted for them, so that we can be able to contain this virus. Can we do it? Yes, we can.
Thank you very much, Dr. Cummings. Can I ask Kizzy M. and perhaps Kanisha Carroll, the daughter of Nurse Maynard, to share with us your final thoughts before we wrap up? Starting with Kizzy.
Okay. Well, once again, I want to say, on behalf of myself and my entire family, thank you so much, Imran, for facilitating this platform and for giving us the opportunity to bring our aunt's story to the forefront and to the public, and for allowing us to, bring awareness to her untimely demise. Additionally, I'd like to add that, when it comes to addressing, I guess, the decision makers, specifically the Minister of Health and all others that are affiliated with him, when it comes to healthcare, but more specifically the COVID virus in Guyana, based on what our family went through, but more specifically what my aunt went through, some key pointers that I'd like to highlight and point out, in terms of making this situation better for future patients is, revamp your infrastructure with regards to your healthcare system, right? Make sure that, if you have dedicated facilities that are allotted to the care of the COVID virus, that you have enough trained doctors and nurses to adhere medical care to these patients, right? We talked about the conditions and the circumstances of Liliendahl and how they were extremely and severely understaffed. And I think that due to the severe lack of staff is what led to the neglect and care for my aunt and the other patients there. I don't know that any other family member will have this opportunity to, be able to come to a public platform and express and share all of the appalling circumstances that occurred at that facility. But I definitely want to take this opportunity to make sure that I'm strongly and clearly advocating not only for my aunt, but for everybody else that's there. I spoke to somebody today whose family member passed away. So it's like every day there's a death or perhaps multiple deaths there. So if we can do something to just address that and minimize the deaths and make sure that, the facilities are fully staffed with trained and equipped employees, healthcare workers, I think that would make a significant difference in the manner in which patients are cared for. And it probably would even in a positive way affect the survival rate and the success rate of your medical facilities going forward. So these are things that I'm hoping that they will take into consideration going forward. Thank you so much for the opportunity. Kenesha?
Thank you very much, Kizzy, for your eloquent and passionate call. Kenesha, would you like to share with us your final thoughts?
Yes. I would just like to say that I think that the healthcare workers, they need to be appreciated more. The pay should be equal to the workload because satisfied workers generally perform better. When the workers are overworked and they are underpaid, they can become more stressed and complacent. So I really think they need to do work needs to be placed in that area, and also proper dietary measures should be implemented. It should be suitable to the patient or the patient's needs, the unique needs. Like in the case of my mother who was diabetic, they were giving her tea with sugar inside, and instead they're giving her insulin to combat the high blood sugar. And that is all.
Thank you so much, Kenesha. I'll now ask the acting leader of the opposition, MP Roysdale Ford, for his final comments before we end this press conference. MP Ford?
Hi, good afternoon again. Thanks, Imran, for this opportunity to wrap up. And a good place for me to start are the last words made by the daughter, I believe it was, of Ms. Maynard, when she spoke about the treatment of the healthcare workers. Whilst this press conference was going on, I received a message from a healthcare worker, and I'm going to summarize it, and I'm going to read parts of it. And it goes back to the issue of the treatment of the healthcare workers and the treatment of public servants, the treatment of teachers by this government. This is a message from a member of the Guyana People's Militia who would have been assigned by this installed government to go out into the communities to assist and to provide service. They're deployed at vaccination sites throughout the country, so they're performing frontline work. And he's saying to me that for the past 5 months, they're still waiting for their monthly salaries. For the past 5 months, they're out there every day providing vaccines to the people of this country and still awaiting their monthly salaries. And the explanation given to them is that the president, the installed president, Irfan Ali, did not sign off the necessary documents for them to be paid. And this is about 400 ranks across the country. But Irfan Ali has the time to go and occupy and spend government monies to run around the country, to go to Region 2 to campaign. And now people are here without salaries, 400 or more of them, but they have to go out every day to provide vaccine service to the people of this country. So this also captures the abandonment of good governance in relation to the people of this country. This afternoon, citizens, the family of Nurse Maynard would have lifted the curtain that veiled the Lillian Dahl Hospital and the national healthcare system of Guyana, and particularly in relation to the care of COVID-19 patients. The stunning revelations are indeed worrying and they're very disturbing. The death of Nurse Maynard has to be looked at in the context of lax enforcement of common sense guidelines that the virus in our country. This is the healthcare system in which Priya Manik Chand wants the children to go to school and have face-to-face learning in. This is the healthcare system that Priya Manik Chand wants the teachers to go and teach in, to teach in institutions of learning, exposing our children potentially to this sort of healthcare to be treated in. They're locking out staff, healthcare staff. Obviously, patients will be neglected, and we heard this afternoon. I make no apology to say that Lillian Dahl Hospital, based on the comments this afternoon and the statements made by the members of the Maynard family, that the Lillian Dahl Hospital is nothing more than a hellhole. The revelations are disturbing. They are horrendous. They are indicative of the collapse of the entire healthcare system in this country. And Frank Anthony is responsible for the death of Miss Nurse Maynard. Irfan Ali is responsible for the death of Nurse Maynard. And the PPP civic government is responsible for the death of Nurse Maynard. We recall them saying that COVID is a hoax. COVID is not real. We heard them saying that people will have to die. And indeed, unavoidably, unnecessarily, over 600 of our citizens would have died since this government came to power. They have not one day shown any empathy, not one day provided any word of comfort to the people of this country. And that is why the family of Nurse Maynard need to be commended for coming out and standing up. And this is the sort of responsible conduct that we expect of citizens. It's very disturbing. And I've sought to speak as little as possible so that we understand that these issues are real issues. It is not just politics. We advocate politically, but these are real issues. So, the reality this afternoon, citizens, is that a government has converted the Lillian Dahl Hospital partially into a step away from a mortuary. That is what we're hearing this afternoon. And these are very disturbing times. I believe that it is time for the people of this country to indicate clearly and condignly. It is imperative now that we make it very clear that this sort of care of our citizens, this sort of irresponsibility is no longer acceptable in this country. And I thank you for joining us this afternoon. I commend the family again, and I provide them with my service if necessary and the service of the people of this country. And we once again thank you for allowing Miss Nurse Maynard to remain in this country despite numerous opportunities she would have had, obviously, to depart these shores. She remained a citizen of this country. She remained faithful to this country and to providing the service for all of us that we so needed at this time. And I thank you very much.
Thank you, Honorable Leader of the Opposition, Acting MP Roysdale Ford. A special thanks to the members of Nurse Maynard's family for joining us today and providing all the information that you have provided so clearly and so eloquently. Our sympathies, deepest condolences are with you once again. You'll remain in our prayers. I'd like to thank Dr. Cummings and all the members of the media who joined us today and the many persons who have been viewing the live stream of this press conference online. We will remain, as the Leader of the Opposition Acting said, in service to the family, and our support will continue throughout this very difficult period that you are going through. We thank you once again, and we ask you to have as best of the rest of the day as you can. Goodbye.
Thank you, Emran. Bye.
Thank you. Bye.
Okay. Casey, you still there? Or she gone?
I think she left.
Okay.